Welcome back, my dear students. Today we are going to learn about cardiac output and stroke volume, two very important ways to measure how well our heart pumps blood to keep every cell alive and working. Cardiac output is the total amount of blood the heart pumps in 1 minute, while stroke volume is the amount of blood pumped out with each heartbeat. These two are closely linked to how hard the heart works, how fast it beats, and how strong each contraction is. Understanding them helps us know how the heart meets the body's needs at rest and during activity. So, let's explore how our amazing heart outputs to keep us healthy and active. Let's begin. The heart specifically has special fibers that make it beat on its own, even without signals from the brain. But how fast and how strong the heart works depends on what the body needs. All body cells need oxygen from the blood to stay alive and healthy. When you exercise, your cells need more oxygen, so they take more from the blood. When you rest, your cells need less oxygen, so the heart does not have to work as hard. Cardiac output basically is the amount of blood pumped out by the left or right ventricle every minute. Cardiac output is equal to the stroke volume or SV into the heart rate or HR. Stroke volume is how much blood the heart pumps out with each beat. Heart rate is how many times the heart beats in 1 minute. A normal adult has about 5 liters of blood, and this whole amount flows through the body every minute. If stroke volume or heart rate goes up, the cardiac output also goes up. Calculating the cardiac output is actually the amount of blood pumped out of the heart in a given time frame. Usually it is measured in liters or minute. Heart rate or HR is how many times your heart beats per minute. Stroke volume is the volume of blood pumped out with each heartbeat, that is in ml. So cardiac output is equal to heart rate into stroke volume. So cardiac output is the volume of blood ejected in 1 minute. Normally the value is 4 to 8 liter per minute, and heart rate is normally 60 to 100 beat per minute, primarily controlled by our autonomic nervous system. And stroke volume is the volume of blood ejected during systole, and it is affected by preload, contractility, and afterload. We will discuss in detail further. So, for example, we can say that during light exercise, stroke volume can increase to 100 ml per beat, and heart rate can increase 100 beats per minute. So, the cardiac output during light exercise is 100 ml into 100, means 10 liter per minute. But during hard exercise, stroke volume can go up to 130 ml per beat, and heart rate can go up to 150 beats per minute. So cardiac output can be 130 ml into 150, means 19.5 liters per minute. Cardiac reserve. Cardiac reserve is basically the difference between your heart's maximum output and its output when you are resting. Most people have a cardiac reserve 4 to 5 liters, 4 to 5 times more than the resting output. Top athletes can have a cardiac reserve 7 to 8 times more than their resting output. So people with serious heart disease may have almost no cardiac reserve, so even simple tasks feel hard for them. How stroke volume is regulated? A healthy heart pumps out the blood that fills it during the resting phase or diastole. So if more blood comes back to the heart during diastole, more blood will be pumped out in the next beat or systole. When you are resting, about 50 to 60% of the blood inside the ventricle is pumped out with each beat. The remaining 40 to 50% stays inside the ventricle after each beat. This is called end systolic volume. Three main factors control stroke volume. Preload, that means how much the heart muscle stretches when blood fills it before a beat. Contractility, how strong the heart muscle squeeze during a beat. Or afterload, it's the pressure the heart must push against to send blood out of the ventricles. The first image shows how cardiac output is determined by two main factors. One is heart rate and the second one is the stroke volume. and which is influenced by positive contractility, preload and afterload. Together, the higher heart rate and greater stroke volume increase the cardiac output, ensuring that enough blood is pumped to meet the body's demands. The second image explains the preload and the second image explains the preload and afterload in heart's function. Preload is basically the volume of blood in the ventricles at the end of the diastole. Higher preload stretches the muscle more, leading to stronger contraction, and afterload is the resistance the left ventricle must overcome to eject blood. So higher afterload means the heart must contract with greater force to push blood against the resistance. Together they influence how effectively the heart pumps the blood. The third image shows how cardiac output depends on heart rate and stroke volume. Heart rate or beats per minute is influenced by nerves and hormones, while the stroke volume ml per beat depends on how blood volume and vascular resistance. Together, these factors determine how much blood the heart pumps to supply the body's need. Preload and stretching. Preload means how much the heart muscle fibers stretch before they contract. More stretch or more preload makes the heart contract more strongly. It's like a rubber band. The more you stretch it, the stronger it snaps back. So when the heart fills with more blood during diastole or resting phase, it contracts harder in systole or pumping phase. This is called the Frank-Starling law of the heart. End diastolic volume or EDV. Preload basically depends on end diastolic volume, that is EDV, the amount of blood in the ventricles at the end of diastole. The bigger the EDV, the stronger the next heartbeat. What decides EDV? Two things control EDV: duration of the ventricular diastole, how long the heart has to fill, and venous return, that is how much blood comes back to the heart. If your heart beats faster, diastole is shorter, so there is less time to fill. EDV becomes smaller, and if more blood returns to the heart, then EDV goes up. So now high heart rate, we can say high heart rate effect. If your heart beats too fast, over 160 beats per minute, stroke volume often goes down. This is because there is not enough time for the heart to fill with blood. People with a slow resting heart rate usually have a bigger stroke volume because there is more time for filling and more preload. Balancing right and left heart. The Frank-Starling law keeps the left and right ventricle pumping the same amount of blood. If the left ventricle pumps a bit more blood returns to the right ventricle. The extra blood reaches the right ventricle more, that is higher EDV, so it contracts harder and balances things out. Contractility is the strength of the heart's contraction for a given preload or stretch. If contractility goes up, stroke volume goes up, even if the preload stays the same. Inotropic agents, things that increase contractility are called positive inotropic agents, and things that decrease contractility are called negative inotropic agents. This image explains the Frank-Starling relationship, showing how stroke volume increases with greater ventricular end diastolic volume due to stronger muscle stretch. Positive inotropic effects like from the sympathetic nervous system or digoxin boost contraction strength and stroke volume, while negative inotropic effects like beta blockers reduce them. The graph visualizes how these factors shift the curve up or down. How positive inotropic agents work. Positive inotropic agents help more calcium ions enter the heart cells during an action potential. More calcium ion makes the heart squeeze harder. Examples of positive inotropic effects are sympathetic nervous system, the fight or flight part of the nervous system, hormones like epinephrine or norepinephrine, higher calcium levels in the fluid around heart cells, the drug digitalis, etc. Negative inotropic agents are things that weaken the heart's contraction are negative inotropic agents. Its examples include less activity of the sympathetic nervous system, anoxia or lack of oxygen, Acidosis means too much acid in the body. Some anesthetics, high potassium levels in the fluid around heart cells. Some calcium channel blocker drugs also reduce contractility by stopping calcium from entering the heart cells. Afterload. Afterload is the pressure the heart must push against to pump blood out. The heart starts pushing blood out when the right ventricle pressure is higher than the pressure in the pulmonary trunk, about 20 mmHg. The left ventricle pressure is higher than the pressure in the aorta, about 80 mmHg. When this happens, the higher pressure in the ventricles pushes open the semilunar valves so blood can leave the heart. Cardiac output is controlled by heart rate and stroke volume, and we know hormones and nerves control the heartbeat, heart rate, and blood volume and vascular resistance control the stroke volume. So what is the effect of afterload? The bigger the afterload, the harder it is for the heart to pump out blood. If afterload increases, stroke volume goes down, more blood stays in the ventricles after each heartbeat. What increases afterload? High blood pressure like hypertension can increase afterload. Narrowed arteries due to atherosclerosis or fatty deposits also make afterload higher. This image explains how cardiac output depends on heart rate and stroke volume. It shows that heart rate is influenced by factors like autonomic innervation, hormones, fitness, and age, while stroke volume is affected by heart size, fitness, genders, contractility, contraction duration, preload, and afterload. So the formula at the bottom summarizes is cardiac output is equal to heart rate into stroke volume. So I hope this class helped you to understand cardiac output, how your hearts pump blood efficiently to meet your body's need. If you found this helpful, please like, share and subscribe for more easy lessons. Keep learning. See you in next time. Thank you.